Hi team, today I want to talk to you about exercising through pregnancy. Now, often exercising while pregnant can seem scary or it might appear like you're harming the baby, but majority of the time, exercise is the best thing you can do for your body and also for your unborn child. Now, exercising while pregnant comes along with the normal benefits such as weight management, mental health, heart health, all of those sorts of things, but specifically while you're pregnant, exercise plays an important role in managing the risk factors for developing preeclampsia or gestational diabetes. Exercising while pregnant can also help with pelvic floor control. It can help to manage pelvic pain or lower back pain. Now, think of pregnancy as running a marathon. You need to be fit for this. Not only is your body changing and you're now having to hold a heavier load through your tummy, the actual labor itself can be also quite physical. So you need to be fit for it to be a healthy labor and potentially an easier labor. So not only are we thinking about pregnancy, but once you've got your child, they're going to get bigger, you're going to have to carry them, chase after them, pick them up, so you really need to be looking at your physical fitness. Now, there's obviously some considerations that come along with being pregnant, and these considerations need to be thought about when you start exercising. The first is that your body is going to start to release an increased amount of a hormone called relaxin, and this has the potential to create an increased risk of sprains or strains. So relaxin is a hormone that makes your ligaments and tendons a little bit more stretchy, and the idea is this is going to help with the birth canal. However, it doesn't discriminate and it can potentially make your ankles, your knees a little bit more lax. So if you're doing movements that are on an unstable base or require a quick change of direction, just be mindful that your ligaments may be a little bit more lax than usual. The second thing to look out for is that as your belly grows, as you become more pregnant, your center of balance changes, and so your coordination and your balance may change over time too. And this isn't a bad thing, it's just something to be mindful of. So if you're doing a yoga pose or a more challenging technique or position, just be mindful that your center of balance is starting to become a little bit different than usual. Another thing to consider is changes in blood pressure. So as your pregnancy progresses, your blood pressure will drop, and this can increase the risk of dizzy spells. So be kind of mindful when you're going from a floor position to standing that you take this really slowly and you take your time to get up so that you're not going to fall and injure yourself. So these are some considerations to look out for. There are more, but everyone is different. Pregnancies are different. If you are new to exercise and you're just starting to exercise now because you understand the benefits, that's great. Let's just think about starting really slowly and look at engaging the help of an exercise professional so we can start slowly and progress over time. If you are already a long-term exerciser, keep doing what you're doing. Slow it down a little bit as your energy levels dictate, and consider some complications of exercise over time. Again, it might be a good idea to talk to your doctor, see a women's health physiotherapist or exercise physiologist so they can give you some tips along the way. Remember, exercise is great for you. There are just some considerations to keep in mind as your body changes. But overall, exercise is the best thing you can do for your body, for your unborn baby.